BBC listeners, how are you? I'm Jean-Paul Habimana and I'm with my colleague Theo Koze. We are going to present one health intervention plan to the control of schistosomiasis in the Mnisi community in South Africa. And this program was sponsored by Bill and Melinda Gates Foundation. In this presentation, we are going to look what is schistosomiasis disease. We are going to look health risk and economic risk associated with this disease. We are also going to look one health intervention plan in the control and prevention of schistosomiasis disease, where we are going to look who will be important stakeholders in the control, ethical clearance, success criteria, intervention tools, budget, and potential challenge. These parts of one health intervention plan will be explained to you by Theo Koze. What is schistosomiasis? Schistosomiasis is also known as bilharzia. It is a disease caused by parasitic blood flux in the genus of Schistosoma. It has different type of species, where we have Schistosoma mansoni, Schistosoma hematobium, and Schistosoma japonicum, which affect human side. And on animal side, we have Schistosoma bovis and Schistosoma matei. But also we have hybrid like Schistosoma hematobium and mansoni, and the Schistosoma matei and Schistosoma hematobium. Those are hybrid which can affect both animals and human. The disease attack urogenital organs and intestinal organs. It is characterized by blood in urine as clinical signs, diarrhea, growth retardation, learning difficulties in children. All those are associated clinical signs. The transmission cycle involved host and vector. Host can be human or animals, and the transmission starts by eggs, which is released by host, then go into water, penetrate snail, develop until they penetrate again host and develop again. The involved organ, the host, is liver, urogenital organs, and intestinal organs, as you are seeing on this picture. Factors associated with this disease include contaminated water, shared water point, no flowing water in seasonal rivers, presence of cyanide in stagnant water, poor sanitation, lack of slaughter facilities, and lack of awareness in the prevention and control of schistosomiasis disease. Now let's talk about health risks associated with schistosomiasis disease. Schistosomiasis is number 2 tropical disease after malaria. It causes annually 200,000 of deaths. Over 800 millions of people are at risk. 76 endemic countries, among them 46 are in Africa. We have 207 millions of infected people. Among them 85% are in sub-Saharan Africa. And this most of clinical disease is underdiagnosed. Other health risks include high prevalence among school kids, and the disease causes complicated vaginitis, which increase HIV susceptibility. We record also poor safeness for animals. Here we have economic risks as published by Wright, where we record the total estimate annual world loss amount of $641 million US, which is associated mainly to the reduction of of productivity due to partial or complete disabilities, but here the loss associated to public health protection to schistosomiasis is not included. Other economic risks include loss of productivity to animals, but the disease is not regarded as major animal disease. So let's continue with the rest of the part by One Health Integration Plan, which is going to be presented by Theo Koze. Thank you.
Good day, I am Theo Koze, and I will discuss the integration of the 3 dimensions of the One Health Intervention Plan, namely the human factor, the animal factor, and the environmental factor. The following headings will be discussed in this part. Number 1, the stakeholders, the ethical matters, the ways to determine the success and the outcome of our project, tools that can be implemented, our budget, and lastly, the potential challenge that we may encounter. Now, first of all, the partaking stakeholders. All the people that are involved are important partakers. First of all, the infected population that suffers is the core focus. Other important stakeholders, from the medical staff to the veterinary and paraveterinary personnel, scientists, leaders of the community, and authorities. The media and the supporting pharmaceutical companies that supply the medication, as one big team effort to lift the burden of disease from this community. When we consider ethical matters, the participants have certain rights that will protect them and their animals. First of all, the protection of their animals to be treated and the procedures that will be followed, and they will be aware of any risks that might be involved. Further on, if the people themselves are treated, they must agree to the procedures that will take place in the prevention and the control of the disease, and be aware of any risks that they might be involved in. And lastly, the participants that are under the surveillance of the disease during the whole period of time have to confirm that they agree to the procedures and are aware of all or any risk factors that may occur. This scientific part of success criteria, according to Chihaka and his co-workers, stated already in 2010 that understanding of the immunological responses is key in understanding the parasite dynamics. They formulated mathematical models of schistosomiasis pathogenesis, and they simulate the control of the disease. There are other qualitative and quantitative mathematical properties of epidemiological models that can be studied, and that was mentioned by Lau et al. in 2018. Different thresholds of treatment rates and evaluations of cost effectiveness are important matters. Other co-workers like Finn, Lee, and Milner was busy with these research work. The education or the awareness of the community is also to be monitored, and questionnaires or specific surveillance models can be implemented to determine that. And then lastly, to monitor the integration and the cooperation between One Health partners to determine the success of this intervention plan. The tools to be used in the intervention plan can be a combination, but the key factor is the fact that we must respect the water resources. Safe water supplies, not only for human consumption, but also for the animals that drink the water. And the water, even if we treat the snails or use molluscicides in the water, we must be sure that we don't cause further damage to the environment. So I feel that the water is the key issue here. And that's the reason why the municipalities must build proper public sanitation facilities and recreational swimming areas. And even when we talk about the animal husbandry, that the animals will be managed in such a way that the water is, the safeness of the water is of paramount importance. And that education will play a main role in that. Proper education, GLOMO already in 2030 made a study, and we can further our knowledge on that, where he discusses or did some research on social ecological model of communication and health behavior in learners and their perceptions that surrounds them. Other intervention tools is the fencing of open dams and water pools that must be strategically fenced off so that the wild animals can still drink in wildlife parks, but areas are prohibited for swimming and domesticated animals that are carriers. Mass treatment of humans with a drug of choice, and the drug of choice in our opinion is praziquantel. Studies by Olivetta did in 2016 discusses the mass drug administration and global control of schistosomiasis, all the successes, limitations, and clinical outcomes. Vaccination against the parasite is still in a developmental stage with a massive budget that must be taken into account. Mass treatment of animals with this drug, especially bovines, also with praziquantel, is a costly amount that must be considered. Our budget was calculated when implementing 9 different tools in this plan or this project, and that was done within a 2-year period. And because it's a costly disease, this amount of money of $10 million in this area is depleted before the 5-year period. But We are of the opinion that the money is well spent and it will control the disease as well as bring curement and as well as lifting of the burden of disease on the community. What is important is that further surveillance studies must be done so that the prevalence of this disease must be better understood in this area as well as the neighboring areas. Again, I want to emphasize the fact that we must protect our water resources. That's the most important part of lifting this disease burden from the community. But there are still potential challenges. We are not sure of the prevalence in the neighboring areas, the infected people, the infected wildlife, the infected animals that is farmed with, the ignorance of the community about the clinical symptoms, the prevention and the control of the schistosomiasis are still factors that must be managed properly. Finances is always a constraint, and there's still more finances needed to extend our effort in this regard. But we are full of hope, and thank you for listening to our presentation. And we are looking forward to when this whole project will be launched so that we can lift the burden of disease from this community. Thank you very much.